If somebody was starting a GLP-1 and I wanted them to have the best experience possible, these are some things that I would tell them as somebody who has lost 150 pounds on a GLP-1. Part 4. Often, what people get concerned about is if they have an injection site reaction. And obviously, for a lot of people on GLP-1, this is the very first time they've had to inject something into themselves. So it can be scary if you do the injection and there starts to be a little bit of redness, or it starts to get itchy, or you start to see pain or swelling. And full disclaimer, I am not a medical doctor. I am just somebody who has researched this in my 2 years on this medication. But in general, as long as it's mild, not causing major issues, that isn't anything to worry about. It's kind of common. Not everyone's going to have it, and some people won't even have it until they've been injecting for weeks. Generally, these reactions will go away over time, but here's what can cause it and what you can do to kind of make it not happen as often, or to take care of it when it does. After a few weeks of doing the injection myself, I did start to have some pain. What I did to make that stop is I started pulling the medication out earlier than I did the injection. And this just kind of allows the medication to warm up a little bit, because if you have cold medication going into warm skin, sometimes it's been shown to make it more itchy, to make it more red, to make it hurt a little bit more. So once I started doing that, my reactions really stopped. But let's say you're doing that and then you're continuing to have a reaction. If your reaction is pain, what you might want to do is you might want to slow down doing the injection, because sometimes that pain is coming from going too quickly. You also want to make sure that you're not tensing up your muscles. If you're putting it in your thigh, that is where I've had the most pain. And even then it wasn't a lot, but it's because I have more muscle there, and so I would be tensing them, so make sure you're relaxed. People have even used ice cubes to kind of numb the area. I've never had to do, but I do always use alcohol wipes. I wipe off my vial before I take it in. I wipe the area off before I take it in, and you want to make sure it's dried, because that can also cause some major issues. It can cause infection if you're not making sure it's sterile. If you are having itching or redness at the site, you can use antihistamines like hydrocortisone, Zyrtec, Benadryl. Sometimes people use cold compresses afterwards as well. And you also want to make sure that you are rotating that injection site so you're not hitting the same one too often, and you might have a reaction in one site and not have it in the other. If you're continuing to have reactions, you might also want to talk with your provider to see if you need to switch to a different GLP-1. As always, whenever I had any issues, I did not trust what someone on TikTok was telling me. I contacted my provider. I currently use a telehealth called iVeem, and I just wanted to make sure, hey, I'm injecting this into me. Is everything okay? There's nothing wrong with that. Your provider should not get upset with you, or your doctor should not get upset with you. They should want you to reach out if you're feeling any kind of concern. The worst thing that you can do is to honestly think everything is okay, and then it isn't. So especially if these reactions are not going away, or if they are making it to where you really can't live